Hip replacement helps hundreds of thousands of Americans each year to relieve their hip pain and get back to enjoying everyday activities. As with any surgical procedure, there are defined inherent risks that you should be aware of. Medical risks of hip joint replacement include infection, which can occur in the days or weeks after surgery. Infection can also occur at any time during the life of the artificial hip replacement if bacteria migrate to the joint through the bloodstream from another part of your body. It is recommended that you take preventive antibiotics after your operation for routine procedures such as dental work. Your doctor will let you know how long you need to keep taking them. It is important to follow these instructions. Infection of the hip after artificial hip joint replacement almost always requires additional surgery and prolonged use of intravenous antibiotics. Other medical risks of hip replacement surgery include blood clots involving the leg or lungs, complications from anesthesia, nerve or blood vessel injury to surrounding tissues, failure or delay of wound healing with loss of skin. A hip with multiple scars in previous operations is particularly at risk. Postoperative bleeding, possibly requiring blood transfusion. Heart attack. Stroke. Other problems may occur with the implanted joint itself over the life of the patient or lifetime of the implant. Although infrequent, these problems can occur and include implant loosening, thigh pain, especially in uncemented hips, dislocation, breaking or wearing out of the implant itself, reaction of the body to particles wearing off the implant, persistent restriction of motion, fracture around the implant following a fall, formation of extra bone around the artificial hip, unequal leg lengths. Unequal leg lengths after surgery are not uncommon. Despite careful measurement and assembly of the hip joint replacement, the diameters or lengths of the implant must often be modified to achieve a truly stable hip and to avoid or reduce the risk of dislocation. Initially, after hip joint replacement, a person may sense that their legs are different lengths, when they are in fact the same. This is the result of tightness around the joint and hip musculature. This goes away in the months after surgery. If leg length inequality is a persisting long-term issue, a shoe lift may be required. Before, during, and after surgery, your physicians and other medical professionals will take many steps to avoid any complications, performing various tests to ensure you can safely tolerate surgery. For example, you will be given a medication to thin your blood. This medication, either in oral or injectable form, helps to reduce the risk of a blood clot. You may need to take this medication for up to 2 or 3 weeks after the surgery. After your surgery, you may also have devices that compress your legs or feet to further reduce the risk of a blood clot. During and after your surgery, you will be given several doses of antibiotics to reduce the risk of infection.